So my name is Mariana, and I am here on behalf of SPMES, which is a governmental entity that provides us services such as purchases, financial services, and information systems for the Portuguese National Health Service. In this context, I currently manage the team that is responsible for the development of mobile applications within SPMS, which includes mobile applications focused on citizens, such as my NHS Wallet, as you have referred, and also to professionals. SPMS had already made available Citizens Portal, which is available since 2014. So when we created the mobile application, the first statements that were made were taking into consideration the usage of the Citizens Portal. So we basically made an analysis and a study of the prior 3 years of the Citizens Portal in order to understand which kind of functionalities and services our citizens were using more. And with that in mind, we started creating a set of functionalities. Of course, we always understand and we always need to take into consideration that you will not do in a mobile application all the things that you do in a computer. So in addition to the statistics of usage by the citizens, we also took into account the fact that the mobile phone will not have the same behavior of a computer, but that was the main analysis and study that we did and still do in order to decide what is important to include in our mobile applications. So I would say the appointments, the renovation of chronic medication, the consultation of prescriptions, those are also quite used, and then the exams, both the requests and the exam itself. Considering the concept of integration, it always depends on two sides. So there is a team or an entity that makes the services available, and then we will use that service in order to present it to the citizen. So the timings are they will vary because of this. Okay. Some are faster to implement, and other are a bit more complicated. In addition, we also have that question that we have a lot of local systems that are spread over primary care and hospital entities. So in Portugal, we have some sort of decentralized health systems in each hospital or in each primary care unit. So sometimes it is difficult to aggregate with consistency data from our patient because they are registered locally. So that has also been a great effort and a great challenge in order for us to be able to present information to the citizen in a structured way. Because it is being collected in some cases in very irregular formats. So in order to mitigate that, we use international standards such as NOMED-CT in terms of semantic. We use HL7, also more in a technical aspects, in order to normalize and to give consistency to the data, which in some cases when it is recorded in older systems is not quite consistent. Well, of course, in terms of organization, there are always a few barriers, but that is has been easily surpassed. Many times the problem is to actually convince some of our citizens to refer to digital services. In this matter, unfortunately, for the reasons that we know, the recent pandemics, COVID, has in certain ways instructed the patient to connect with the health systems and eventually with other systems too, financial, etc., in a more digital way. Because even though we are always trying to modernize our sector, the health in this case, in some aspects it is still difficult to do it, because Portuguese people, they like it. They like, in some cases, to go to the hospital, to talk to the doctor, and so it can be a barrier. But I think we are doing a great work in order to promote and to disseminate the usage of digital services, not to end with the contact, but as an alternative way of doing it. People will still go to the primary care units, will still go to the hospitals, but we will also be encouraged to use the digital systems. And sometimes we have periods that make that advantage to pop up, such as now. If we did not have a well-structured digital system, it would have been much harder to deal with the pandemic than it is, in fact, because we already have tools that allow us to give interaction of the patient and the professionals at distance. So I think we were actually well prepared. It's always a question of continuous learning, and sometimes this is difficult when we are dealing with the citizen. When we are dealing with professionals, it is easier for us to call in a meeting 3 or 4 representatives for primary care units or for hospital healthcare, and they will give us our input, and it's easier to establish the target of the system. When we are dealing with a citizen-focused application, well, we have 10 million possible people that we will use our systems. So sometimes it's a bit difficult to establish the target and the focus of the mobile application, because we really need to envision what will be important for the biggest part of the population. And that is not always clear, because there are a lot of needs. So as I have referred, the My NHS Wallet mobile application was launched in January 2017. At that time, the authentication was almost not basic, but intermediate level of security authentication. The patient, the citizen, would enter its date of birth, the beneficiary number for the health system, and the mobile phone that is registered in our national system. If all of those 3 parameters were correct, we would send them to that mobile phone a code, and you would enter, and we would verify his authentication. That was the process that was implemented in January 17. Later, by the end of 2019, we implemented the digital mobile key as an alternative. So we kept the 2 methods running up. And then since January this year, we have removed the first intermediate security option, and the authentication is exclusive done via digital mobile key. The digital mobile key is a strong authentication method that was developed by a governmental entity that is responsible for the modernization of our administration. In Portugal, when you have a citizen's card, when you go get your citizen's card, which is entirely digital, you can use it in your computer in order to access multiple platforms, governmental and not only. They give you codes for that, and they give you also the option to have a digital mobile key, which is a transposition of the authentication via your identification card to your mobile phone, because you will obviously not introduce your identification card in your mobile phone. So they have created a sort of alternative and highly secure authentication method to the citizen's card itself. In terms of disadvantages, it is a process that is still a little bit difficult to implement when you have populations that are not so much used to digital services. Yes, it is a work in progress, and that is actually a good question. It is the question that we make ourselves every day. Also, it always depends on the population that we are considering. Because we already have many citizens who are concerned with the security of their data, especially if it is health data, because there is always a fear that the data, my health data, can be spread over person or entities that I don't want it to be. So we already have many people that are truly concerned with the security and the privacy of their data. And for those ones, this is actually a very good authentication method, because it is a two-factor authentication. You have one code that only you know, and then you have a code that is sent to you in that moment, and so it is a strong authentication method. For people that are not so keen in these questions of technology, it can be a bit hard to leave the common user credential, user password method to have this more complex authentication. So it's a question of measuring, and we truly believe that the future is to grant security, even if this means that at first it will be a bit more difficult for people to access our services, but in a mid-time that will be surpassed. First of all, benchmarking is always very important. I have referred in the beginning of this interview that we have done some benchmarking regarding our citizens portal. It is also important to refer that we have also done it for other mobile applications in Europe and etc., in order to better understand the needs and the dynamics associated to this. So benchmarking is always important to understand what is being done outside and inside. And then probably the most difficult part is to adapt that benchmarking, the results of that analysis, to your own reality. Because the same solution will not have the same impact and the same utilization in different cultures. So these 2 points, to understand what is happening outside, and then to be able to transpose into our realities, considering our failures, our benefits, in order to satisfy our population.